Hi, welcome tonight to our class. We're talking about the nagging neck. Now, a lot of people may not have a nagging neck. Maybe it's a sore, achy, but it leads into an accumulative strain and also arthritis. So I'm Dr. Stephen Sanford, and welcome to our class tonight. With what you learn from it, we want to have it a teaching class so that you can take what you are learning and help yourself and help others. Because this arthritis, the osteoarthritis I'm going to talk about, is preventable. Yeah. So computeritis, I like that name, and the text neck, right? Accumulative strain, sprain, and arthritis. So symptoms of a nagging neck, the tension and the ache, you may or may not have pain, but some people have the pain that go from the mid-back on up through the neck. There could be headaches and periodic migraines. The shoulders in people with a nagging neck are rounded forward. You'll see that. Some of them, if the inflammatory is enough, they're going to have tingling and numbness in their arms and their hands. So, what is going on? And let's talk about some of fears and frustrations that I hear from people. The loss of ability to focus in their job, their decreased work production. That leads into, am I going to take and be able to last at this job? Is the pain going to get worse? Do I have to have surgery? When will arthritis begin? Will I be active in retirement? We want to get there and be active. Can these headaches get better without medication? Well, let's see what is stopping us, right? Because really what we want to do is, our desires is to be productive. We want to be in the yard doing our yard work. I know Bob he loves that type of stuff, right? He's doing a good job with it. At home, you want to be doing your favorite pastimes and hobbies without dealing in the pain of the ramifications of pain and overdoing it. Other things that you want to do is be able to do your job pain-free. Be that productive, helpful worker that we can and should be. To have a physical body that endures a lifetime of the physical stressors. Our bodies are supposed to last us a lifetime. And we're running into problems with this arthritis, and we can do better. We want to be balanced physically, emotionally, and mentally. So let's talk about some of the causes. In the neck, there are paraspinal muscles, and they run from the occiput, each side of the spine, all the way down to the sacrum. These and the joints are called the primary movers. They're called primary movers because they tell the other muscles and joints what to do. They're going to determine whether they're going to be active and supportive, or are they going to be protective and stuck. It kind of flips a switch on there is what it does, right? And our care and your care that you can do flips the switch back on and keep things moving. So, some of the other causes is texting. Everybody's seen the text deck, right? Okay? This is what we're starting to do too, right? And the head weighs 11 pounds. And if you know about physics, that stress of going forward is going to accumulate. Yeah, I can see people shaking their heads. Yeah, I'm getting it, okay? So, things like working on the computer, and chronic stress, the fight or flight mechanism, the energy goes into our muscles, and if we exercise and use our energy that builds up from stress, it dissipates. But if we don't, and we just stay and let that stress accumulate on there, that's what kind of gets us into fight or flight. We want to get out of the fight or flight, we want to be in the parasympathetic, right? So, it's an accumulative stress and strain. There can be causes of the falls and injury, and then dehydration. So you should be consuming half of your body weight in ounces of water per day, up to 90. After you go past 90, you're going to be kind of peeing out some electrolytes. But before that, we need to be hydrated, right? And part of the problem is we are being dehydrated. So that is, take your body weight, divide it in half, and that's how many ounces of water you should be consuming in a day. Up to 90. It's a lot, yes. The problem is we're not consuming enough. So we're not being hydrated. That's part of the decrease of the disc and the wear and tear and such like that. We'll talk about that in a little bit. Okay? Maybe consuming an inflammatory diet, because inflammation is what we're talking about. And there's different causes. There's physical inflammation and there is inflammatory from foods. Now, a sedentary lifestyle without movement to balance the times that you sit versus the times that you should be up and active on there. We'll talk about statistics about it, okay? Well, let me tell you about my story. It happened to me injury. I was playing in 2011, I was playing racquetball. And at that time, I was about a B player. It goes, beginning is D, and then C, and then B, and then A, okay? So I'm a B player. I'm on the right side of the court, and the ball gets hit and goes to the back corner. There's 4 of us in the court. So I turn and go grab it. As I'm doing a backhand this way, the gentleman that's in the corner has to give way. He comes out and trips me. Full speed into the wall. Head and shoulder. Okay? And it took me 4 months. I was out of work and I had to do rehab on it. So my concerns, will I be able to continue to work as a chiropractor? Because it's a physical job, right? And can I return and play competitive racquetball? Good news is, I am playing racquetball and I'm at that A level now. Yeah. So what really happened to me is I created my own repair and remodel rehabilitation system to get me back on the job and in the court on that, right? So it was repair and remodel. Repair is the cellular turnover. When we have injury and or every 7 years, we have turned over our whole body cells, right? Every 7 years you get whole body cells. So cellular turnover was part of the repair here. And the cells that are being turned over, the ones that are, it's fibrosis of repair. They take glue, your body, your body takes glue and it takes single strand fibers and glues them together. That's called repair. And that takes weeks to months to happen on that. Now the remodel is where you take that and you have to start being, get movement on it. Flexibility, strength, and balance, okay? So I had to go through repair and remodel, and that's what we're going to talk about tonight too. So I understand how this process goes, right? So what's it going to cost us, right? If things don't change, we're going to have possible osteoarthritis. CDC, everybody knows CDC, right? Okay, the government. In 1997, the cost was $86 billion. In 2003, $128 billion. The latest stat I saw was 2009, $168 billion from osteoarthritis. Now we're not talking rheumatoid, we're talking osteo. This is the wear and tear degenerative osteoarthritis. Rheumatoid arthritis is an inflammatory arthritis. It is different. Okay, rheumatoid is going to be with the disfiguration of the fingers and hands. The osteoarthritis is more spinal, hips, knees, such like that, okay? Right. So chronic neck pain is a leading cause of disability, and it's been doing that for 15 years straight. And what at age 18, right, 7% of the population has osteoarthritis. When you get to 45, 30% of the population. When you get to 65, it's 50%. Now, of that 50%, 44% had no leisure time activities, right? Means they're not getting up, moving around. They're not doing any physical, okay? We're not moving, okay? That's, I think, a big key right here. We need to move. We need to have a plan, all right? So this kind of is a little bit of the doctor stuff on here, right? The neck and the back arthritis, it's called cervical spondylosis, if you hear that from a doctor in there. It is a gradual wearing down or degeneration of the cartilage and the bones in the cervical spine. Although it can be caused by injury, the condition is most commonly caused by accumulative changes brought on by daily normal activity. Over time, the disc between the vertebrae may begin to dry and shrink. This increases shrink, slip or collapse, and cause the spaces between the bones and the disc to narrow or collapse. This places increased pressure on the facets. The facets are the back joints right here, because most of the weight pressure is supposed to be on the front of the body. As the we don't move, we're not hydrated, right? We start to decrease this, that's what happens. Then you see it, it's breaking down on there. That's arthritis, right? And the cartilage changes to where it gets to be bone on bone, right? We don't want bone on bone, right? All right, so let's put this all together. The anatomy and physiology of the spine. The spine has 24 interlocking, movable vertebrae on there. Now, in each vertebrae, there's 6 joints. 1, 2, 3, 4, 5, 6 joints per vertebrae. There's 24 times 6, that's 144 of these joints in there. That's a lot, isn't it? Yeah. Okay. And each one of those joints has cartilage on it. Cartilage does not have an artery or a vein to it. Okay? So how does it get its nutrients in and waste products out? Motion. Movement. Okay? It's key here. We have to get movement so that circulation happens in the disc on there. And then there's 4 curves that balance out the spine. There's the sacral curve, the lumbar forward curve, the thoracic back curve, and the cervical forward curve. Now that's there for balance, and we have flexibility. So if those curves are there, we're doing much better on there, right? There's 3 layers of muscle from what we see from this area right here, and I think this is mostly what we're talking about with the nagging neck, right? The first muscle is the trapezius muscle, this one right here, and then the trap is cut away, so you can see the second layer of muscle, which is the rhomboids and the levator right here. The third muscle group is the closest to the spine. These are the paraspinals that go up and down. What did we say about the paraspinals? What are they? The primary movers that tell the other muscles how to be. So if we have stress or strain and the body goes in and flips the switch, we're not moving in there, what do you think is starting to happen? We're not getting our motion, we're not pumping, we're going to take and have a loss of our, and then it gets sick and it starts to decrease in height, and then the body has to do something, so it treats it like a broken bone in there. That's where the calcium deposit comes in, right? Yeah. So The nerves, right? We were saying sometimes you get tingling and numbness down that arm because the nerves come out of the lower neck. If we start to shrink in height with the space between and the opening here, we start to shrink this, what happens? Pressure, irritation, inflammation. Now, we normally have a sensory that goes to all of our body, and we don't, because it's normal, we don't really notice it. However, you lose that, and you get tingling or numbness, now you start noticing. Okay? All right. So, we want to take and do things that improve our chance so that we can have a body that lasts us a lifetime. So let's talk about how we can heal and improve it, right? So the people that are dealing with a sit-down job on there, one of the things that they get done on there, I know you just had one, right? It's called an ergonomic study. And there's a lot of information that you don't have to have somebody come do it to there. You can go on the web and you can figure out what is my best posture. Because if I take that 11-pound head and I go forward with it, what's it going to do? It's going to stress out, and then the body's going to have to react to it, right? So what are we going to do? We're going to take breaks to vary our position. We're going to stretch, and some people, I have them set a timer to remind them, because you get so focused. You're focused and you're doing it, right? Do you take a break and go out and go for a walk? If you can, but a majority of the people, they just have to stand up, change their position, kind of do some movement, such like that, but set the timer. Kind of get yourself into a pattern of movement on there. It will help out quite a bit. Another thing you can do is stretches. And I teach 6 stretches in the 3 planes, for the neck, the mid-back, and the low back. That is at championchiropracticcenter.com that you can find those stretches at. I videotaped them because I teach them all the time. I got tired of teaching them every patient in there. And I'm like, okay, let's get into the 21st century. We're going to take a video. I'm going to take and put them on our website, and then you can go get them, okay? It's called the 6 stretches in the 3 planes on there. So, I think you kind of see where we want to get moving. However you want to move. Do you want to walk? Do you want to dance? Find some type of favorite activity on there, right? But you gotta move. You gotta circulate. You gotta get this body going on there, okay? Remember the 44% sedentary, not getting up, moving around? There you go. There's a problem on there, right? Now you're going to take and have some inflammatory reactions as you go through this, but hey, you know what? You got to keep going on there. If it happens, back it off, kind of regroup and change it up a little bit, and then get going again on it, okay? It's those that persevere and get to the next levels that then things get easier and such like that. But it does take some work, doesn't it? Right? Let's talk about our diet, right? You got to watch your diet because, right? Every how many years do we get a new body?
7.
7 years, right? Our cellular turnover is happening. So what we eat actually becomes us. But we have to take and have a balance of proteins, carbs, fats, fibers, and minerals in our diet to feed our body what it needs so it can take and produce the cells, right? We want to eat real and raw, a diet that is alive with nutrients, right? Okay, so real and raw. We also want to take and have a clean diet. No preservatives, no pesticides, growth hormones. That is, I think we're kind of getting the idea of what's going on out there. They're taking our food and they're changing it, right? But is that food what our body needs and can use to make more cells and their cellular turnover? Or is it doing the best it can with what it gets? And that's, we're going to, in 7 years, are we going to be doing well? Are we not going to, right? Okay, we have to do it on a daily basis, right? So, eat clean. We want to avoid sugars. Sugar is a real problem in our society on there. And Alzheimer's and such like that is coming down to some sugar stuff, okay? GMOs. Everybody knows what GMOs are now, right? They are changing our food. They're calling it food, but it's made in the lab, it's cheap, and our body, what are we going to do with this, right? It's trying to do as best it can on it, right? But we ate so much better when we had our own farms and we can trade out things and stuff like that. So I think we're kind of getting back to some of that, and that's good to see. So we want to take and stay away from any chemicals in our food, right? Because the chemicals will increase the inflammatory in the body. And inflammatory in the body goes into pain and protection. What's protection going to do to us? So it decreases our movement, right? Our body goes into protection. So it's part of the process here. So what I do, what are the benefits of chiropractic rehabilitation and nutrition, right? I made up this path of health to kind of talk about what we do as chiropractic on that, right? People come in usually with the ache, pains and headaches and migraines, can't sleep, they're missing work, numbness, tingling, difficulty getting through the day, digestive issues, right? Okay, that to me is called, they want some relief. So we go through relief, but then the next one is corrective care. Now, pains decreased, headaches have lessened, we got improved digestion, we're sleeping better, our swelling's going down, we can work through the day, we got relief. Now we're on corrective care. Corrective care is all about needing to do it so you don't relapse right away, right? We want to take and move you forward to where you feel good, to where you're stable on there. But we got to heal ligaments, tendons, muscles through the adjustive and the home care. We want to improve sensory and motor nerve communication so that our body communicates and functions and heals itself in there. We want to do some exercise, maybe some massage, maybe some PT, but it's all about that repair and the remodel. Remember, the repair is that cellular turnover and taking the body from type 1 to type 2. I think that's the next slide. I'm kind of getting a little bit ahead of myself on there. Okay? But we'll talk about repair and remodel in there. But patient wants to see steady progress, improve, and this corrective care leads to stabilization. That's where people, I think, want to go with it, right? So it's a process that requires commitment from both the patient and the doctor. But once we take and get you stable, then it's wellness and supportive care, right? So as we go through our life on there, there's going to be times where, oh my gosh, I need to, maybe a desk job, I need to see once a month to where I have the support so where I can keep and stay well and not wait until 2 years later I need some relief care, right? It's all kind of a balance thing here, but I've made this so that we can communicate, what do you want? Some people want this relief, correction, get to your stabilization. I want that wellness, I want to see you once a month. Okay, cool. Other people are like, nah, just give me some relief, I'm good. Okay, we're good with that, right? But it communicates what it is that you want to do. I can't make you do anything you want to do. We need to partner together and figure it out. All right, that's what I made that up for. All right? So what I do, my goal is to get you to move well and restore function. I assist in the repair and the remodel, right? Repair is the mending of the tissue. Now, type 1 tissue is your original tissue when you were born with, right? Type 1 has 2 fibers and then has a spring that's wrapped around it. That has 2 fibers, neighbor, wrapped around another. At the springs, there's connections on there, right? So it has strength and it has flexibility in it, right? So when we have injury, right, i.e. hit a wall, okay, or something like that, or cumulative strains in there, right? We need to take and mend, but we don't mend with our original type 1 tissue. People, have you heard of type 2 collagen tissue or scar tissue? Most people have heard of scar tissue, right? That's what we heal with, right? And scar tissue is that, again, it's fibrosis of repair. We have single strands with glue across the injured tissue on there. And then we have to take and remodel. Remodel is flexibility and strength and balance to take and get that glue to unglue on this, and to get it to remodel and mend so that your strength on your tissue, and that happens over time. So, any questions on repair and remodel? Kind of get what we do in there? But it's not the original tissue, it's type 2 collagen tissue. Now, type 2 collagen tissue, if people have repaired more with the type 2 collagen tissue, that's a weaker tissue. It is inflammatory, so they're going to be swelling, right? It's hypersensitive, they're going to feel the pain of it. And overall, it's going to be less flexible, right? So in an injured area, we're going to have issues because we have now a different tissue that's in that area, right? Okay? But it can be remodeled as well as it can be to be flexible on there. There's still some soreness that I have with my shoulder on there, but I'm going to keep that thing moving. We're going to keep that going, right? So another thing that I do is the spinal treatment. Now I treat the neuromusculoskeletal system on there, right? What I do is I go through and I palpate the spine and I feel moving, oh, there we go. This is what's called a fixation on there, right? We're moving pretty well, but that's the spot right there, right? Okay, and it's there red because you don't feel, oh, yeah, that's sensitive on there. And those of you that are patients know what I'm talking about. It's like, ooh, yeah, you found it, okay. So we get in there, and I use with my hand a drop piece mechanism to take and guide back in to position in motion and flip that switch. Get that thing turned back on. Get that body more, oh, I'm going out of protection into motion now. And then I go back and I recheck. And I see, oh yeah, and you know that there's a sensory change in there. It's like, oh yeah, you got it, thank you, right? Okay, that's the spinal treatment that I do. Other therapies that I do too is cranial therapy. Cranial therapy is set up to where the pelvis and the cranium work together in a pumping mechanism to take and in the brain there forms in the holes of the brain, right? There forms cerebrospinal fluid, and cerebrospinal fluid is supposed to go through to the rest of the spine on there, and it does it through a pumping mechanism, right? And that's why I do cranial therapy. It circulates the cerebrospinal fluid throughout the spinal cord. So those of you that have had cranial therapy on there, right? It's used to treat headaches, migraines, ear and jaw and chewing issues on there. Extremity adjustments, I use a small, I didn't bring it up, a small drop piece in which I do shoulder, elbows, wrists, knees, and the feet on there, right? And carpal tunnel, right? Carpal tunnel on the wrists is supposed to be an opening that the nerves and the tendons go through, and it has a wrist, like a sweatband on it, right? Called a retinaculum, okay? When people are doing their wrist and repetitive movement on there, or the carpal itself has fallen on there, you have to reestablish it, and that's what I do too. So I've saved people from carpal tunnel surgery on there, right? And the other thing that I do is foot levelers, right? Because as your foot hits the ground, there, if you have an arch that's dropped, it's going to rotate the knee and change where the pelvis alignment is, and that's going to then change the for what the shoulder is. So if you take and you help the arch here, it's going to take through the whole chain reaction and get you more balanced up. So that's another thing that I do. All right, so most people have good bones, they just need a little rehabilitation. So those 6 stretches on the 3 planes, that's one thing that we work on, right? force transmission system. This is interesting. The way that force goes in our body, we want to take and help our ability to stay flexible and movable and such like that. But we produce force in a way like when you vacuum. You don't stand straight and do this. You turn the body and you get your force movement, right? Look at how the fibers, right? The fibers have these little motor units that are very, very tiny. Hundreds of them in one strand on there. How many strands are in a muscle group? There's a lot of them, right? And it's called a motor unit. And actin and myosin, and they all, not all, one at a time recruit. It's an all, like a contraction, and it's only microscopic on there. But they found that the motor unit takes and causes movement in the muscle in there. So you follow the muscle strand, and that's where movement's going to happen, right? So our force is going to go up here, and then right here at the butt, there's not only one layer, there's two layers. And that sends it over to this side of the body. You're following it up, right? Into the lats and then into the shoulder. So your right hand is hooked to your left foot. That's why you do it this way. You don't do it this way. You're going across the body, push and pull, okay? And you can see on the front side, this goes up, and then right here is where it starts to change, and then the obliques and the pecs. So in the front and back, it's tied together, and it's in a twisting force transmission system of the body on there. So we're going to make sure that that is worked also on there. Some of the other things I have people do is abdominal bracing on there, right? Abdominal bracing is this right here. Now try this, right? When you take your belly button and you bring it in and up, right? Put your hands on your back here, right? And feel. When you abdominal brace, what happens to the lower back muscles? When you tighten these, what happens to the back muscles? It tightens too, right? Abdominal bracing. So what you want to do is help yourself as you are bending and lifting and such like that. You want to abdominal brace and bring it back up, okay? So abdominal bracing, okay? Another thing you want to work on is the psoas muscle, right? Psoas muscles are your hip flexors. And they go, this is looking from the front to the back of the spine on there, right? Here is the muscle that goes up into the pelvis, but up into the lower back too. These are your hip flexors. They do this. So your hip flexors, right, are the front part of the body, and the extensors and the traps on there. The extensors are these paraspinal muscles, and that pull it back, right, okay, and the trapezius muscle. So these muscles versus these muscles have to be balanced. All right, another thing that I teach on too is sit stabilization on there, and that's on a ball, and you lift one foot up, right, and you have to balance, because core is king on there. That's what I'm trying to kind of teach on here. But sit stabilization on a ball. Another thing that we do is storking. Storking. That's when you're brushing your teeth, you're standing on one foot, right? And you stay there and see how you do, right? If you can stand there, great. Then you start to grab a bottle and you start to move one direction and then the other. You put pressure on your body so that your core reacts like this. Now, that's going to save you from injury and fall, hopefully, right? So that you don't have to think about it, but your body will be able to react to it, right? That's why we do these type of rehab exercises, okay? Another thing that we offer here is functional nutrition. Most of you know Lexi does this, but the system strength analysis. It uses muscle testing to find weaknesses in systems or organs and it strengthens it with the proper supplement, and then the proper dose too. And it's amazing how we can ask the body these questions now on what does it need and how much does it need, and more information, we can supply that for you. But we know that the nutrition is very important, because what we eat in our diet on America usually isn't enough and specific enough for some of what our body needs in there. And if we get deficient, then our body's going to take and have problems functioning and breaking down, such like that. So we feed it what it needs to fill in with what we don't get in our diet, right? So that's part of the functional nutrition that we do. All right, so let's move forward here. Let's talk about the next steps on here, right? The first step is you have to decide, are you ready to take and have change? Because if we keep doing the same thing, we're going to keep getting the same results. At 65–50% of our community is going to have osteoarthritis. It is totally preventable, right? Because we're not moving and we're not eating the proper diet on there, right? So what I offer is a 15-minute consultation at no charge. I want to hear about your story and what's happened, and then we can map out things that have changed and a plan to kind of move forward here. Those of you who do not have insurance but are cash on there, we offer, instead of $144 for the exam and the report of findings, we offer it for $50. Those of you that have insurance, we'll check your benefits and see. So I want to thank you for coming tonight and learning about osteoarthritis and how we can prevent this from happening to us and the ones that we love. So champions, we want to move well, we want to eat well, and we want to think well. Think well. Thank you for your time.